Great. Well, it's the top of the hour. We'll take a few more minutes to provide you an opportunity to enter your information in the lobby questions. And yes, Sarah, this presentation will be available on our website. So as we mentioned, these are state technical assistance webinars. Our goal is to provide more targeted technical assistance information, and today's presentation will be on systems thinking. So thank you all for joining us. We're very excited to have you all with us. Thank you so much for taking the time to meet with us today to discuss systems thinking. We're very excited to have some former COIN states, some current CSLC states, and some new states joining us today on this call. I think that's going to provide us with a very rich context for our discussion today. Great, so we'll get started. And thank you all. If you didn't get an opportunity to respond to the questions, please enter your information in the chat on the left so we can capture your information. So the topic of today's call is improving your injury, violence, and prevention system, connecting programs, processes, people, and data. We are funded by HRSA, and CSN is HRSA's primary vehicle for providing technical assistance in infant, child, and adolescent injury and violence prevention to state and jurisdiction Title V agencies. So that's the email that we sent out, was to all Title V agencies. So we thank you all for joining us today. Some technical tips. As with all of our calls, audio is broadcast through your computer speakers. If you experience any audio issues, you can call in. You are muted. You can download the resources in the file share pod. And please use the chat pod on the bottom left at any time. This session is being recorded and will be available on our website in a few days. And I'm sorry, you are calling in for audio. So if you have any issues, please let us know, but you should be able to hear us through the phone line, and your lines will automatically be muted. So we have two presenters today. My name is Maria Catratis. I am a CSLC Technical Assistance Provider and the CSLC Data Director. We provide technical assistance. And my current topics, I'm leading the topics for poisoning prevention and suicide and self-harm prevention. And our second presenter today is the CSN Project Director, Jennifer Leonardo, who is also the CSLC Improvement Advisor. So we're very happy to be on this call with you today. And we'll get started with Jennifer.
Great. I'm very excited to have you all on the call today, and I've been working in health systems strengthening and management and leadership development for 17 years using different quality improvement approaches, and I've seen teams become very clear and inspired on a vision that they want to achieve and achieve results. I think it's the kind of work that warrants doing some reading, looking through the material, and then really applying it. So I do encourage you to download that resource that Maria mentioned. It is a resource that has been adapted for injury and violence prevention specifically, and hopefully you'll see some visuals in here, some maps that can help your team get going on your systems work. So we're going to start with the question of what is a system? A system is an interdependent group of items, people, or processes with a common purpose or aim. And your team should feel empowered to really think about what are you defining as a system. You can look at an entire organization as a system, a division within your organization as a system, a coalition, a particular program or project, or different partnerships that come together to achieve a common purpose. So there's certainly liberty in terms of you sitting down and saying, what is the system? What's the scope of the system that we are going to define and that we're going to work to strengthen? And here's a visual that I'll be coming back to at different points in the presentation. And this visual is really, it's really aimed at having you sit down and do some real work and say, let's put down on paper a SMART aim. Let's think about what we're trying to achieve over what time frame and making sure that it's relevant, that it's a stretch, but it's still achievable. And then I would encourage you next to think about what's the outcome of that system. So your aim statement and your outcomes are going to be related. And that will help you to start to think through what are all the different inputs that go into your system, those individuals and organizations, all of the resources, be they educational resources, financial resources, and then the primary clients or beneficiaries of your system. And then what are the processes that all of these inputs are feeding into? What are all those interrelated processes that will lead to your outcomes? And how do you measure whether or not you're achieving your aim statement? I want to give you a little bit of background on the elements of systems thinking. Peter Senge is a thought leader in the field of learning organizations, and he talks about different disciplines of a learning organization, and he lays out 5 of them. And his 5th discipline is the systems thinking discipline. And this is really the discipline that is going to integrate the disciplines of having a shared vision, having mental models in place, a commitment to team learning, and a commitment to personal mastery. Systems thinking is what's going to help you keep from just jumping on to the latest trends that are happening, because it's going to focus you. I'll talk just a little bit about these different disciplines in here. Your shared vision is really about fostering a commitment to long-term outcomes. Your mental model is about being willing to have openness to unearth some shortcomings in present ways of seeing the world, and having your team push one another in a collaborative way to do that. Your team learning is really about developing the skills of the groups of people and thinking about the larger picture, not just the individual perspective. And personal mastery is fostering personal motivation to continually learn how your own actions affect the world. And without that personal mastery, people often stay steeped in a reactive mindset. So on this next slide, I want to give you an example of how the elements of systems thinking can be applied to an injury topic, bullying prevention. So if you're going to work on a system that is really aimed at bullying prevention, your shared vision could be that schools are free from bullying with norms of respect and safety. And you may have to do some work on the mental models of your team members. It could be that you're changing the mental model that is viewing prevention as requiring only the implementation of a single program or a single training, and really starting to think more broadly that you're involving different departments, that you're involving different sectors, and that the mental model, the approach is going to be different. For team learning, you may want to establish and convene some school safety committees so that you can coordinate a whole school approach. So you may be thinking about your team in a larger perspective, your parents, your students, your staff, your social workers, etc. For personal mastery, it could be that teachers and other school personnel start to learn how to actively foster safe and supportive school environments. So they take the learning and then they start to apply the learning in the school setting and with the kids. So before I jump into talking more about advantages of systems thinking and how to use some of the tools, I would like to have you participate and answer the below poll questions. Does your organization use systems thinking? If yes, does your organization develop systems maps, such as the one that I showed you a few slides ago? And then how has systems thinking impacted your organization if you are using it? Great. I see a lot of people are responding. We have about 63% of you saying that you do use systems thinking in your organization. Wonderful. Around 35% are not currently using systems thinking. And not many, about 28% are using a systems map. So it's very interesting. Lisa, thank you. So systems thinking is helping your organization to keep focused and on task. Wonderful. I see here Janet Watkins is saying that in the Tennessee Aware model, you developed some logic models. That's very helpful. Yes, I think you'll start to see some linkages with the different tools that are out there. Mick LeMay, analyzing helps us address the outcomes. Great. And if I may ask, I'm going to call on a couple of you because we have a little bit of time, just to ask you to provide a little bit more here. Lisa, would you mind unmuting yourself? You can press star and pound if you will. I'd like to hear a little bit more about how it's helping to keep you focused and on task. I don't know if we have Lisa. Sometimes I just pick on people. Forgive me for that. But if you are there, Lisa, I would love to hear a little bit more about that, either in the chat or you can feel free to unmute yourself. Oh, we have some comments coming in from the Wyoming team. It helps to reframe strategic planning, moving down the pyramid. And from Vermont, Stephanie Bush, our organization is just starting to incorporate systems thinking efforts. Great. So maybe the Vermont team can hear and learn from some of the others on the call. Oh, Lisa, very funny. If you hit a star key and then the pound key, that should unmute you. Okay. Well, we will catch you next time, Lisa, but thank you for your willingness to jump in. I'm going to move us along to the next slide here. So yeah, some of you already touched on this, but the advantages of systems thinking are that they enable you to better understand and manage complexity. Once you start to have more complex or larger systems with more processes, it can be a little bit challenging to keep all of those smaller pieces in mind. It allows you to anticipate and prevent unintended consequences. You can really see all of the different segments in your system. It makes it easier to spot and address challenges, gaps, or bottlenecks. Systems thinking helps you to identify and implement the high leverage changes and cross-cutting strategies. So it really forces you to say, well, we have a finite number of resources or inputs that are coming in, and we want to achieve these outcomes. So you have to be really select in looking at what are those high leverage changes, and maybe there are some things that we shouldn't continue doing or that we should adapt, and maybe some new things that we should be putting into place and trying. And it supports more rapid scale-up and spread of effective change strategies. Talk a little bit about understanding your system. You want to focus on the structures, the relationships, the processes, and the patterns rather than on a static or an isolated event. So a static, it could appear that there's an isolated event, but if you go back to really thinking of the big picture and looking at your system, you can see how that event is related to the other relationships and processes and start to do some deeper thinking around why that isolated event may have taken place. You can recognize that cause and effect are often separated from one another in time and location, and it can make it difficult to see the connection between them. So that gets back to even looking at those isolated events and what's really taking place and causing them to happen. You can also understand that an action in one part of your system can have an unintended consequence in a different part of your system. And we're going to talk a little bit about that right now. And it's not a bad thing necessarily when it happens. It's all learning. So I like to take the approach that we're going to stumble and fall, but as long as we continually learn, that is really going to get us to our outcomes. So let's look at an example here of an unintended consequence that could be taking place. So if you're focusing on preventing bullying in one location of your school, it may result in its occurrence or escalation in another location within that same school. It may be that you really started to focus on incidents that were taking place in the lunchroom, for example, and maybe you have a lot of increased monitoring there. But because of that, the students respond to that environment, and then they take that same behavior and actions, and they just put it somewhere else. And maybe the bullying starts to increase outside at recess instead in the lunchroom or on the bus. Another example here is improving or increasing screening for suicide risk with a healthcare organization may reveal a lack of capacity or training to provide treatment and referrals for the positive screen. So an unintended consequence, but it's an opportunity is the point. It's an opportunity to strengthen your system. Increasing distribution of child safety seats in your county may lead to a need to address incorrect installation of seats in that county. Perhaps that gets uncovered now that you are doing more work there. And finally, increasing the prescribing of opioids to reduce pain may inadvertently contribute to an increase in opioid addiction, which I believe a lot of us have been hearing a lot about lately. So I want to take the time now to go about looking at some components of the system. And in this webinar, we only have the time to get into a few of these. So you saw the map, and you know that you have all these different components, but we're going to talk a little bit more about the aim statement of the purpose, the relationships within the system, and then the processes within the system. Because we know that not only the parts, but the relationships among the parts are all opportunities for improvement. So looking at the aim statement, every system needs to have an aim statement so that everyone working within that system can know what they're working toward. And the aim statement is a value judgment. It's your purpose. So you need to know what that is in order to work toward that future state. If you want to have a written, measurable statement about the expected outcome, it'd be helpful to write it in smart language, specific and measurable, attainable, relevant, and time-bound. It should be very clear. You should have consensus on it. It's sometimes helpful to have a visioning workshop when you're sitting down with your team for the first time, either to create the new aim statement or to revisit what you have. And it should be forward-thinking. The second part of the system I want to talk a little bit about are the relationships within that system. You should identify the interactions and the connections that are necessary to accomplish your work. Broaden your operations planning so that you're including more components of that system as you identify them. Describe your system using the maps and the linkages. And then promote regular visits and interactions between departments, agencies, and other system components. And that's what I'd like to underscore. It's once you recognize all the different relationships, how are you going to operationalize those relationships? What schedule may you put them on? How often and how may you go about making sure that those partnerships and relationships are effective? And the third part of the system that I want to talk about is processes. By analyzing your processes within your system, you can start to establish common understanding of how the work gets done, the complexity that's involved. You can identify non-value steps or bottlenecks that you may be able to remove. Identify the decision makers and the key personnel. So who are those key people that you need to really be communicating with, making sure they're at the table when you're doing this work. Clarify any roles and responsibilities. Break down silos between organizations or divisions, and envision your ideal process. Your processes are a set of causes and conditions that repeatedly come together in a series of steps to transfer your inputs into your outcomes. And if you're feeling a little confused at this point, saying, oh, what's the difference between a process and a system, don't feel badly about that at all. It's a very common question that we receive. So this slide just offers some definitions. Your processes are smaller, concrete, actionable steps. They're routinized, they're repetitive, they transform your inputs into your outcomes. Your system is larger. Your processes sit within your system. The system sometimes is looser. It has multiple partnerships, very complex, and is characterized by all those different relationships, and it has the overall broader impact. So an example of an injury prevention process could be checking installation of a child safety seat and teaching a parent or a caregiver how to install the seat correctly. And an example of the system would be maintaining the entire network of child safety seat installation sites. And let's take a look at this in a little more detail.
Great. So please feel free to enter some of your processes in your systems that you work with below. Jen, we're hearing some feedback on your line. If you could check your headset.
I'm not, let me know in the chat if you're not hearing it. I don't think, I don't know what to do about that. Is it clear now, Maria?
It's better now.
I can also remove my headset completely and just use my phone. Why don't I do?
Yes, that would be great.
Okay, how is this? A little better?
Yes, this is better. Thank you.
Okay, thank you, Carol and Elisa, for bringing that to our attention. I really appreciate that. Okay, in front of us here we have an example of a process in injury prevention, and this is for screening for suicide risk at a physician's office. So you can see here that we're starting on the left-hand side. It's a flow chart. Then a patient receives the PHQ-9 screener upon check-in, and the patient completes the PHQ-9 and gives it to the medical assistant, at which point the physician reviews the completed form. And then if the patient screens positive for depression, they're going to follow one process. If they screen negative for depression, they'll follow a different process. So this is an example of how detailed you can start to become when you start to lay out these different processes. And then this process would go right in the middle of this visual of your overall system. And you start to think about, okay, am I only looking at one process, or am I looking at a whole system, and are there interrelated processes that are taking place? So I want to give you another example, and this one here came from Vermont, out of some child safety equipment work, so we thank Vermont for that. And this is a system map for screening for suicide in hospital emergency departments. And you can see here that the purpose of the system is to identify and provide services to individuals at risk for suicide who present at a hospital emergency department. So we have a number of different processes that are linked together, such as ED triage, screening, assessing, treating and counseling, preparing safety plans, referrals, release, and follow-up. So this will be posted on the CSM website, and if you're interested in doing a systems map exercise, I would encourage you to take a look at this example. There's some nice measures laid out here that relate to the outcomes that are stated. Okay, and just to recap here, as you manage your system, a couple of tips. Always keep in mind the purpose or the aim. Develop and use your shared measures, but don't let your measures drive your work. Let your outcomes drive your work. Do the outcomes first, then come up with the measures that make the most sense. You may need to change those measures, or you may need to use more than one measure in order to be able to track what's happening. You want to find ways to get regular feedback from all the clients and the beneficiaries that you list in your system. So sometimes, although we tend to think of our clients and beneficiaries the outcome at the onset of a project, we don't always think through the way to build them into the process over time. You want to monitor the relationships within your system to ensure that you have all the necessary partners and stakeholders engaged and that they are able to work together effectively and efficiently. And you want to continuously scan your system for new opportunities as well as threats. So it could be a nice agenda item on your team meetings to periodically pull out your system map and to report out on what's happening, where improvements can be made, and if your system map needs to be updated. And I see a question here in the chat from Carol. I want to make sure I understand the systems mapping doesn't ID who does what though. So you can, because there's so much complexity in some of the systems maps that you're going to develop, for visualization, it's not on the example I gave you, but I wouldn't let the example limit your team. So you could have layers or the documentation below that, but I certainly would highlight in there, if I were looking at a particular process, who the key personnel for that process would be. Great. Any other questions? Before we move on and I turn it over to Maria, I just want to give you an opportunity to type any other questions in the chat or to unmute your line and ask a question. Okay, well, feel free to go ahead and put any questions in there, and I'm going to turn this over to Maria.
Great. Thank you so much, Jennifer. These are all very important questions to think about. And as you prepare all of your work and systems thinking, we always need to keep in mind how you share your system aim, processes, and outcomes with your own team and with your partners. We want to make sure that these lines of communication are always open and that you continue to do so periodically, because this is always an iterative process. So please let us know in the chats below each of the questions how you share your system aim, processes, and outcomes with your team and also with your partners. We'll give you a few minutes to respond. Great, and we see a few folks are already starting to respond. Great. Terrence Love from Tennessee is saying that strategic plans are shared with coalitions. Great. Great. We have some other folks who are commenting. Does anyone want to speak up? You can unmute yourself by pressing *#. Maybe Mike LeMay, would you like to tell us a bit more about how you share your system AIM processes and outcomes with your team? You can press *# to unmute yourself. We also see a few more folks commenting. Stephanie, Becca. Great. So Becca from Massachusetts is saying that they develop the aims and processes collaboratively. And Stephanie from Vermont is saying that with other projects, I have worked to get buy-in and input from partners while developing AIM and measures. Great. So you're working with your partners directly and then reporting at their quarterly meetings. Fantastic. Great. Thank you all so much. This is really great feedback. Okay. Wonderful. And then Becca in Massachusetts is saying that she also shares the aims with her partners in presentations and official guidelines. Great. Becca, would you like to unmute? Oh, I'm sorry, Becca. Oh, I'm sorry, folks. I'm not sure why the *# is not working. Okay, Van is
Maria,
also
it just started working.
Yes.
This is Becca.
Great.
You have been muted.
Hi, Becca. Welcome. Could you please tell us a little bit more about the process that you, how you share your system AIM processes and outcomes with your team and with your partners? Oh, it stopped working again. Okay, folks, I'm very sorry for the audio issues. We're going to move on, and we'll try to correct the audio issues and have you all participate again in a few more slides. Okay, so let's take a look at how you can begin to articulate this information. We'd like you to think about how you define injury prevention and the key topic areas for your agency, which populations you'll focus your work on, what is the physical boundary of your system, and what is, such as the geographic area, or what is the overarching boundary, such as an age group, for example, or education level. And finally, what are you trying to achieve? Is it a reduction in fatalities, hospitalizations, ED visits? What are the ultimate outcomes? So we'll have these questions in the back of our minds. And here you'll see a range of complexity in system boundaries. So as you're defining the system boundaries, you'll see from less complex systems to extremely complex systems. So we're starting off with a system within one organization, so implementing a program in one school versus implementing a program across a school district, implementing a program in all schools in the state, and eventually implementing a program in all schools throughout the country. So we're going from less complex to extremely complex. And of course, the school is just one example, but we could substitute that for other examples, depending on what you're working on. So how can you define your system? You could defining your system is, of course, an iterative process, and much of systems thinking is iterative. You will engage stakeholders and partners, as some of you have mentioned in our previous chat pods. You'll reach a consensus. You'll identify necessary steps for your system to be successful. You'll identify barriers and how to overcome those barriers, short and long-term improvements, and you'll also establish a way to measure and evaluate this process. This is just as important as all of the other steps. So if you leave out the last part about data collection and data evaluation, you will not know if you are achieving your intended gains and outcomes, and you likely will not be able to also articulate your progress to the stakeholders and partners who are vital to your success. So we want to make sure that you keep this all in mind. So you could start crafting a system map for the driver or the change idea that you're working on. So in order to craft an overall aim statement and start sketching the system, we have to keep in mind all of the different components that you're working on. So according to Deming, the first step in designing a system is clarification. So you want everyone in the organization should understand the aim of the system and how to direct their efforts towards it. So to do this, you can craft the overall aim statement. So in this example on the screen, we have the state aims to reduce homicide, suicide, motor vehicle, fire, poisoning, and falls-related mortality and hospitalizations. So these are all of the topics, and then the actual reduction will be in mortality and hospitalizations. And then below, you can use this aim statement to start sketching the system. So here we see a guide. We have your system would begin to take shape as you're looking at your culture of safety across the state, the system of motor vehicle safety, system of homicide and suicide prevention, and so on and so forth, according to each of the topics. And then you'll also be looking at your knowledge management and quality improvement within the state. So if we drill down to a specific topic, we have motor vehicle safety, and this would be an example on focusing on teen drivers. So by May 2018, the state will reduce deaths by X%, hospitalizations by Y%, and emergency department visits by Z% across the state relative to your state baseline, resulting from a crash in which the victim was a driver or occupant of a motor vehicle and between the ages of 15 and 19. So here you're looking at a very specific process and creating the aim statement for that particular process. And again, this example is specific for teen drivers, so you would be looking at what your state baseline is, and then creating an aim that's the reduction in percent by the specific outcomes, so deaths, hospitalizations, and ED visits. And you're also defining it as the crash, very specific type of crash where the victim was the driver or occupant between the ages of 15 and 19. So a helpful framework to identify different contexts that contribute to injury and violence-related health outcomes is the social-ecological model that is commonly used in public health and by the CDC to better understand violence and the effect of potential prevention strategies. Inherent in the model is the overlap between the levels, demonstrating that factors in one level influence factors in another level, and action is necessary across multiple levels at the same time. This allows us to build a comprehensive system that focuses on both population level and individual level determinants of health. So let's think about the socio-ecological model a bit more. At the societal level, we have social and cultural norms, health, economic, educational, and social policies. Strategies include running campaigns, educating policymakers, forming broad multi-sector partnerships. In the community level, community social organization, we have settings such as schools, workplace, neighborhoods, healthcare sites, community agencies where social relationships occur. And strategies for this level include developing organizational policies and procedures, training staff, including new technologies, including and introducing new technologies. At the relationship level, the closest circle of relationships, including peers, partners, family members. So this is really getting down to folks who are participating with with an individual and are surrounding an individual on a daily basis. So strategies include parenting education and mentoring programs that promote healthy and safe relationship environments. And finally, at the smallest level, the individual, we have biological and personal history factors such as age, socioeconomic status, and education. And prevention strategies at this level are education and life skills training to promote healthy attitudes, beliefs, and behaviors. And you can find a lot more of this on the CDC's website. So if we continue with our teen driver safety example, we can look at some key processes at the societal level. So let's take a look. We can educate policymakers on evidence demonstrating the effectiveness of graduated driver's licensing. We can engage with local partners to develop a teen driver safety campaign. We can create or expand the Teen Driver Safety Coalition. So these are some examples of what we would do to promote teen driver safety at the societal level. If we move down into the community organizational level, we can partner with law enforcement on standard procedures to ensure teens are in compliance with state GDL law. We can provide incentives for participating in teen driver safety programs. And of course, we can partner with healthcare organizations to implement procedures to provide anticipatory guidance on teen driver safety. So of course, these are at the community organizational level. And as you can see, as we're going from societal to community and now to relationship, we are moving closer and closer to the teen. So at the relationship and individual level, we can educate teens on driver safety through evidence-based programs, educate parents and teens about driving agreements, for example, the CDC Parent-Teen Driving Agreement. We can provide teach-back opportunities for teens to improve their understanding of risk factors or being involved in a motor vehicle crash, such as distracted driving, fatigue, and substances. So now the onus is on the individual creating a safe environment for him or herself. So here we see the map that Jennifer had already shown us originally. And here we have examples. Yes, I'm sorry. I see the question. Are these suggestions evidence-based? Yes, I believe so. And we have our comprehensive change packages are all on our CSN website. So you can definitely take a look at those. We definitely recommend that you check those out. So we would like to map the components of the system. And of course, we see on the left side, we have the inputs. We have the aim at the top, the conversion in the middle. So what are we actually doing? And then the outputs are outcomes and measures on the right. So for this aim, we have by May 2018, the state will reduce deaths by 2%, hospitalizations by 8%, and emergency department visits by 12%, resulting from a crash in which the victim is a teen driver or passenger between the ages of 15 and 19. So our inputs are the individuals and organizations involved. So we have the Department of Public Health, Department of Transportation, law enforcement, schools, insurance companies, driver instructors, etc. We have the resources required, the campaign materials, the graduated driver license educational cards, parent-teen driver agreements, driver education curriculum. We have clients and beneficiaries, teens, parents, and schools. The conversions of inputs to outputs include teen driver safety campaign, teen driver agreements, teen driver safety programs, and graduated driver licensing enforcement. And of course, we hopefully will get our outputs, which are our outcomes. Our outcome measures are reduced fatalities, emergency department visits, and hospitalizations, and of course, safe driving practices among teens. And these measures should include enforcement of GDL among teens, safe driving practices among teens, schools implementing evidence-based driving curriculum. So you'll see all of the components that we mentioned earlier in the different levels of the socio-ecological model are components of this map. great. So I think we have a few minutes to chat with some folks. So Jen, are you jumping in?
Sure. Thank you, Maria. I would love to hear from some of the folks who spoke about having systems thinking in their organization. So I am going to try the third time, because it might be a charm, with Lisa to see if you can unmute your line and see if we can hear from you. And if not, if Tennessee, Vermont, and Wyoming can get ready, I may be calling on one of you next.
Hello?
Yes, Lisa.
Yay, this is Lisa.
Wonderful.
I'm so glad to know it wasn't user error, though, at least on my end. And my phone even told me improper entry, and so I just stopped trying. Yes, and so our use of it, my use of it is relatively new, but we are using it as an agency and for our individual programs. And so I've kind of, that's how I keep focused on, for instance, we used it for how can we improve the data that is being input into the system by my child death reviewers. And how can I improve my, and brought it down to, you know, well, training could be one aspect of a way to improve what has been identified as being a need.
Great. And did you, that sounds like you had a process in that system. Did you start to link that to other processes as well, or was that enough?
Not yet, but that is a goal.
Great. And how do you use it with your team in terms of operations? Do you have it on a schedule where you revisit, or certain times of the year that you devote to doing some systems thinking and visualizations?
So far, since we've just been doing it about a year, it's just been, I haven't done that yet, and so probably time to revisit it and do so, and maybe at the beginning of the year here is a good time to do it.
Mm-hmm. Great. Thank you. Yeah, we have a question here from Carol. Where would you list how you're going to measure your outputs? So let me, I can answer that, Carol, but I'm going to first ask Lisa. Lisa, do you have measures that you thought through? And I know that's, sometimes teams don't think of that at the onset.
Right, exactly. I did. I don't know, and definitely didn't meet it yet. It was basically to be the number of cases properly entered into the system, and therefore reducing the amount of quality assurance time that I would need to apply to it. And so probably won't be able to see a change in that until I've been able to initiate the training part. I haven't been able to initiate increasing the training part. And so have planned to increase the amount of handouts I give them to help them understand the system we're using and help them understand the question and know where in the file to find the answer to the question. And so a year from now, hopefully I will be able to have more concrete vision, or not even vision, but answer to how it has gone when I do my data analysis for this year's data.
Mm-hmm. Mm-hmm. And you're really illustrating some of the challenges with the measures that we've seen in working with a number of different states. And sometimes it's good to have those implementation type measures, so how many trainings took place, or how much data got entered, right? So those are good monitoring and tracking measures. And then you could, over time, look at that higher impact measure of the quality assurance.
Exactly. Ultimately, I like to get to see an increased number of folks being able to identify risk factors that were involved, and then, you know, collect all those risk factors to help drive us the next step.
Wonderful. Thank you so much for sharing your work.
You're welcome. Thank you. Appreciate the opportunity.
Yeah, thank you, Lisa. And Carol, do you want to unmute yourself? Or do you want to talk to us a little bit more about your questions on measures? Okay, I see Carol asked, where would you list how you're going to measure your outputs? So on this map, you wouldn't really put all that detail in here, but you could have supplemental information. You could have data guidance that you go ahead and devise, so much like we have in our change packages from the COIN. So you can talk through there, really operationalize each measure, figure out what denominators or what population you're targeting. You may identify if you're going to measure at the individual level, the organizational level, over what period of time, and who you're going to be reaching out to. These are really important and good conversations to have with new partners from which you need to collect data. So they're good conversations to have early on. What's the role of the different parties involved? Who has access to the data? What data is available? At what frequency can it be collected? And does it make sense to be collected at? Because you don't want to overburden your system. So I hope that answered your question. If it didn't, please keep prodding me in the chat. I was thinking about how you would measure safe driving practices among teens. Oh, okay, sure. You had a specific question to the teen driver safety example. I wonder if we have Jeannie Beats from Nebraska on the line. And Terry may be able to say more about this in his presentation that's coming up. So, yes, in Nebraska they had a survey that they were testing out. So, for example, you could look at GDL guidance to help to devise the questions that you put onto that survey as to what safe driving practices are. You could go ahead and, if you're doing a teen driver safety program, for example, you could give that survey to the teens prior to the program, at the conclusion of the program, and then maybe at a 3 or 6 month follow-up if you had access to the teens over time to see if they are able to have changes in behavior and then if they're able to sustain those changes in their behavior. Great, and I see some good engagement there back and forth between Carol from Texas, Jeannie from Nebraska, and Terry from Tennessee. Thank you, folks. Excellent. Okay, so I am going to move us along because I really am eager to also have you all hear from a state that we've been working with in the Child Safety COIN and now in the Child Safety Learning Collaborative. So we're going to talk now about spreading processes that lead to improvement. So specifically talking about how do you recruit those partners? How do you recruit your pilot sites? And I am not going to take too much time here because I want to have Terry from Tennessee jump into his work. But I will just start off by saying that a few key tips. You're thinking about your partners. Where do you start with? Well, start with the volunteers. Who's interested? Go to those people first. You don't need to go to the naysayers first. Go where there's energy. Go where there's commitment, where there are resources, where somebody's willing to try something out. And then start off with that consultant hat on. Share your system aim, your processes, your outcomes, any success stories you have. But make sure you're asking questions of your partners. What are their needs? You're presenting what you're trying to accomplish. What are they trying to accomplish? How are they trying to accomplish it? Do you see synergy? How do you make sure that they're a true partner? Be clear on the partnership aim once you have those discussions. Lay out those roles. Lay out the different resources that are needed and where those resources can come from and what time frame you're going to be working under. And then get into an exploration of how you're going to collect data to see that you're making progress. Start small. Really get some learning in. 1 or 2 sites is perfectly appropriate to start implementing and spreading some evidence-based practices. You may have to do some adaptation to your local context. You're going to learn every time you work with a new partner or a new site. So start with a few willing volunteers, and then once you have that, that work underway and you document that work so you can bring it to other sites to use it for engagement, think about recruiting sites that reflect different conditions. And what this is getting at is that you want to approximate what you would do in a research study. So you try to get generalizability. So you're trying to say, how do we make sure these evidence-based programs that we're spreading are really working with all different kinds of teams, for example. So I may choose some schools that have schools that are in rural areas, schools that are in urban areas, maybe it's schools that are with kids from different socio-demographics, different socioeconomic status. So just start to think about what are all those different conditions in your state that you want your sites to be reflecting, and try to get a good representation across those. All right, so I'm so excited to be introducing
Terry to you. So Terry Love is here with us today from the Tennessee Department of Health. He is the Injury Prevention Manager with the Division of Family Health and Wellness. Terry is a true community leader with over 20 years in community-based prevention. He's worked in multiple settings to develop leaders and motivate stakeholders to facilitate population-level change. He's worked in schools, universities, and in statewide settings. He's assisted communities with identifying and mitigating the root causes of behavioral health, problems including motor vehicle injury, substance abuse, premature death, and other health issues. He loves to influence policy. He's eager to share his knowledge. He's a true team player, a native of Arkansas. He recently adopted the Middle Tennessee as his home, where he continues to work on injury prevention. And his goal is to impact multiple injuries, including but not limited to motor vehicle crashes, traumatic brain injury, suicide, and intimate partner violence. So Terry, I am going to turn it over to you.
Can you hear me?
Yes.
Okay. Thank you, and thanks everybody. I'm so thrilled to see so many folks that care about the same things that I care about. I was asked to share a little bit about a specific example of program spread, and the slide before, everything in that slide follows along with what I would tell you. We were charged with the core of State's Violence Injury Prevention Grant to spread Teen Safe Driving program, a program called Checkpoints, which is an evidence-based program. We started from ground zero, had no programs established, and so what I did to try to do this is first I spread information generally to schools so they'd be aware of it, but then I picked a site that I thought that would be open to it. I had educated some school resource officers in that area, and so then I went to a school resource officer in a county that had a high teen crash rate. This was a school called, it was Smyrna High School in Rutherford County, Tennessee. So I created a presentation specific to that county. I met with the school resource officer first. I gained allies with her and with the coordinated school health coordinator, who had also been educated from the coordinated school health department that I had educated. So I had some kind of built-in allies. And then I asked them to be present with me as I presented to the school administration. And I was able to secure a pilot site there at Smyrna High School. I agreed to remove all barriers for the school. I explained to them, this is an evidence-based program, that this is a program that is going to, have dramatic or have impact on your parents and teens' attitudes and behaviors around safe driving for the new drivers. And I agreed to do everything, provide the materials, do the training myself. Also, I wanted to do the training myself so I could get first hands-on experience with the training and with the parents and teens' reaction to the training and learning, so then I could better market it going forward. So we did that at Smyrna for a semester, and then I used that pre- and post-test data then to recruit other high-risk counties. I think I can forward the slide. And so then my next task was to try to find another site. And so what I did was I went to my daughter's high school principal and said, I'm a parent in this district. I would like my own daughter's high school to have this program. She granted me a meeting, and she fortunately brought the school district safety officer with her. Coincidentally, there had been they had had some deaths in this county. This is Williamson County, Tennessee, right outside of Nashville. And so they had teen safe driving issues. And I was able to leverage this data that I collected at Smyrna and encourage Sarah Lamb, the principal there, to consider the Checkpoints program. She took it back to the superintendent. And then I was invited to make a formal presentation to a newly formed task force they had. And so there's many, many steps, but I was able to present to that task force, and I was fortunate enough that they chose to adopt Checkpoints district-wide, which was 10 high schools. The challenge for that is I needed to be ready. When they said, yes, we're ready to go, 10 high schools, wide. So then we did do that. We trained about 23 of their school administrators to present the program in their schools, and so that was a very successful spread. And then I took their pre and post data, which was a bigger sample, and I presented it at regional meetings, state meetings, and even a national conference. I presented to the HOSA state meeting, the FCCLA, Coordinated School Health Conference, and then we are continuing to try to spread that in Tennessee. So there's a lot of not only strategic planning, and but there's some salesmanship involved. There's relationships, both establishing relationships and maintaining relationships with schools or whatever group you're working with. And this is only one of 4 priorities of the core grant, so we're doing this in other areas as well. But having that pilot project and having good pre and post test data to then share with other schools was key. And then having that Williamson County data to share with other schools. And so what we're doing now is we're working with the Tennessee Department of Education to establish a 7-session teen motor vehicle crash prevention track at their statewide conference in April. And so actually going to try to bring Gene Shope from Michigan Transportation Institute, who helped develop, or is one of the principal investigators for checkpoints, to be keynote speaker at that conference. And then I'll do a presentation. We'll have principals who have worked in their schools to do checkpoints also present at one of the breakout sessions, and even the folks from Kentucky who are having some success with us on border counties. Steve will co-present with me at the conference. So this is, we continue to market to these high crash county schools as we have identified them. And again, that's established by using ED data and hospital admissions data, and crash data. And so we've established criteria for that. What qualifies are, we have about 22 counties that we consider high teen crash counties. So we continue to market to those. I would love to tell you that it's a perfect linear process, and that as you do this, you're just going to gain more and more schools, but that's not exactly how it works. We may leap ahead and grab several schools in one county. I've had schools that have committed to it, and then when they saw one person in the district decides that they don't want to do it, then if they have the authority to stop it, then that's happened to us. So yeah, it's hard work. It's very rewarding when it happens, but be prepared to have setbacks and to keep trying. But I would be glad if somebody wants to email me at terrence.love@tn.gov. I'll be glad to help anybody that I can.
Great. Thank you so much, Terry. Do we have any questions for Terry? You can go ahead and unmute your line by pressing *#, or you can put a question into the chat. We see a lot of good compliments here. It was a very wonderful presentation.
If anybody has any answers, I'll take those too.
I love your point about it not being a linear process and being prepared to have those setbacks. Has that impacted your team at all, or have you had to take some approaches to keep motivation up when that happens, Terry?
Well, I mean, it's frustrating when you think you have a school district committed, or you have, an innovator in the district who's really excited, and then you find out later that the principal might not be an innovator. I will say one of the barriers, I think, for this Checkpoints program was the fact that parents are involved at the high school level. And what we do with this program is we ask the schools to require the completion of the Checkpoints program and the completion of the parenting driver agreement as a condition of purchasing a parking permit. So for some schools, that's a barrier because they don't want to change their policy on parking permits. or for some schools, I don't know how eager they are to have parents super engaged in something or making a requirement of a parent at the high school level. These are just my hunches. I've asked, and I need to do a survey of the schools who've started the process and backed out or who just said no, because we need to know why that's happening, so we can work around that if we can. But again, schools are eager at times to have us come and do a program, kind of a one-shot deal, a mock crash, or a assembly or something like that. But the evidence is not out there for the effectiveness of those programs. So that's why I'm really strongly encouraging folks to look at these effective programs. And it's a constant sales job in some ways. But I do, we have gotten discouraged at times, but then, we'll send out the information one more time and somebody will call us and say, let's talk. So we get excited again. So I'm really hopeful for this conference in the spring as we get more endorsement from the Department of Education. Now we're a legitimate part, a whole track in their conference, and we're bringing in Gene Shope and others. I think we'll have more school buy-in. But schools are, and if you're doing prevention in schools, you need to understand, at least in Tennessee right now, it's difficult for them to do something that's not required because test scores and improving test scores is their top priority. So.
Sure, and I'm sure that also plays into some of the challenges of full implementation with the schools, thinking through how is this sustainable and what resources can the schools put into this on a continual basis. Have you run into some schools taking more ownership and being able to do more of this work on their own versus others? And can you tell us a little bit about that?
Well, it depends on the school. For example, in Williamson County, in those 10 schools, because of really strong leadership at the superintendent level, they were basically voluntold. We are doing this, and we want every school principal to participate and/or find people to teach classes. In Montgomery County, for example, school resource officers, we offered to train them. They initially agreed and then backed out, and so then we went with court officials, and so we have a very fortunate there that Lisa McLean in Montgomery County is able to do those classes. But, that is a barrier, finding someone to teach classes at night. We've trained some school resource officers in Cheatham County. And so, we're continuing to explore different ways to do it. We even considered setting aside some grant money and then paying stipends, but then we ran into issues with, grant money can't pay state employees. Teachers in Tennessee typically are state employees. So we keep looking and exploring different avenues, but it's like I said, if it was easy, everybody would be doing it. But it's a challenge, and but it can be done. It just takes persistence and relationships and planning.
Yeah, well, I love and want to commend you for your innovation, from thinking through incentives like parking permits and then thinking through even funding or compensating folks. And I trust that as you keep at it, you may come up with some of those gems, some things that work in Tennessee. It's about what works in your context, too, and maybe how that can translate to other sites. I do want to get to a couple of questions in the chat. You generated a lot of interest here, Terry. We have Colleen asking if health equity was a concern.
It's interesting you asked that. We just recently in our division have begun a health equity self-assessment. And, the program is offered to the schools based on data, right? So we're looking at crash data. So I will say that Williamson County is one of those schools with a lot of resources, one of those county districts with a lot of resources, but they're also one of our top 10 crash counties. So it's not like we're not favoring any county over others. We're really planning through data. So if you have a high crash rate or a high teen emergency department visit rate or a high teen hospital admission rate due to teen crashes, those are the counties we're looking at. So we feel like it's a fair process, and they are all offered if they're in that. And even those counties who aren't in that risk category are offered as well. But we have been focusing our limited resources on those counties with the data, the crash risk data. And then the other question about driver's education, Tennessee has some schools have it, some schools don't. Just recently, I was working with a David Crockett school, and they have driver's ed, and it was the driver's ed instructor who called me and was interested. So, but then other schools have no driver's education. So it's just kind of school district by district. There is a statue of David Crockett, a full life-size statue in the office of David Crockett School, by the way. If you ever go there, you'll see it.
Wonderful. Thank you, Terry. Carol or Colleen or others, if you have any last questions for Terry, please feel free to unmute yourself, press *#, and we can have him field a few more before we move on. Okay, so if you do have questions that come up over the next half hour, please just go ahead and put those into the chat and we will try to get to them at the end. We're going to, thank you so much, Terry. We're going to move on now to the next part of the presentation where Maria will talk to us about some quality improvement data. So that was a great segue that Terry gave us and really looking at data. And we'll talk a little bit about display of data, analysis of data, and use of data.
Great. Thank you so much, Jennifer, and thank you, Terry, again for sharing your insights with us. So we'll talk about some data, and as the CSLC data director, I'm really interested in making sure that we're always looking at how do we measure change and how do we look at changes. So if we want to find out was this change an improvement? In most of our work, especially in the accountability field, we're accustomed to seeing data displayed as summary statistics and as pre-post measures. So that's what we see on the screen right now. We have a 12-week change, and the change was actually implemented between week 7 and week 8. So we have a pre-score of 8 in week 4 and a post-score of 3 in week 11. So let's look at this histogram and see what it shows. The key questions to ask are, does this test, summarized in this way, afford an adequate degree of belief that the change, once implemented, will lead to an improvement? And are there other explanations for the reduction in delay time after the change was introduced? So I'm sorry, I failed to mention that this is a delay time is what we're actually measuring. So there was a measure of 8 hours before the change and 3 hours after the change. So in the next slide, we'll use some run charts to answer these questions. So here are 5 possible scenarios that offer explanation of the test results that we saw in the previous slide. In each case, there's a delay in time. The delay time for weeks 1 to 14 is shown on the run chart. The test results for week 4, the delay time of 8 hours, and week 11, the delay time of 3 hours, in the red boxes are the same for all cases. So none of those have moved. It's exactly the same. And what have appeared in the histogram, what appeared in the histogram on the previous page. So the red line shows where the change they are testing began. So it's between weeks 7 and 8. So let's look, you can answer the poll below. Which of the run charts shows the change made between weeks 7 and 8 contributed to improvement in the reduction of delay time? So you can answer using the poll below. It's cases 1 through 5. And you can choose which one you think is the correct response. So we see some responses for case 1. We see some responses for case 3. Okay, some case 4. Great, we'll just wait about 30 more seconds to see Who else responds? And then we'll go through each of the cases and discuss each of the cases. Okay, we see a response for case 2 as well. Great, and we have a response for case 5. So we have responses for each of the cases here. Great, so let's go through each of the cases and see what they show us. So in case 1, the run chart shows a possible scenario that could have yielded the results observed in the test. This run chart confirms the conclusion the change resulted in a meaningful improvement. So we see that the change actually, the slope of the line is going down, and that there's a meaningful change beyond the week of the change. In case 2, week 4 and week 11 are part of usual random variation. The measures happen to be on the high and low side of the variation. The change in week 7 is not an improvement. So we see that it's going up and down, up and down, up and down, so it's just part of the regular variation. In case 3, the trend was already headed down. So if you see the line, the slope of the line is already downward. The rate of improvement didn't change when the change was introduced. Therefore, although the delay in time process improved, there's no evidence that the change in week 7 actually contributed to this improvement. In case 4, an initial improvement is observed after the change is made, but then the process returns to its pre-change level. So it initially goes down for a couple of weeks and then goes back up. This could be due to the Hawthorne effect or observer effect. This is when people involved may be more careful or diligent in their work and modifying their behavior after the change was introduced. This reactivity leads to the improvement rather than the change being tested. The change in week 7 is not an improvement, or it could be said that the change is not held because it went down and then back up. So in case 5, improvement happens earlier in week 5. This is before the change was introduced between week 7 and 8. This improvement should be attributed to some other phenomenon, and we can conclude that the change in week 7 was not the improvement. So if you see the line was sloping down much earlier than when the change was actually introduced. So we'll look at data over time in the next slides. Great. So quality improvement in public health is a continuous and ongoing effort to achieve measurable improvements in health indicators through the use of a defined improvement process such as plan, do, study, act cycles. Looking at data over time is useful to understand improvement. For example, a quick glance at this data shows a reduction in the percentage of ED visits with admission. So we're actually at our question time. So we hope that this was very helpful for you. If you have any questions, please enter them in the chat pod, in the question and answer pod, and we can also, you can also unmute yourself and ask some questions.
And while we're waiting to hear on those questions, I just want to summarize for you in the webinar. If you're thinking about, wow, that was a lot of information, and how do we kind of start with this? Where do we go with all of this? I would encourage you to read through the Injury and Violence Prevention Systems Toolkit. The system map is in there. You could think about holding an initial team meeting and trying to fill out that map, starting first with the aim of the system. What are you really trying to accomplish, and can you write a SMART aim statement? And can you identify those outcomes and some measures that will let you know if you're making progress? And then lay out all your processes. Think about why you may not be achieving your outcome yet. Why aren't you at that aim statement? And think about changes you need to make to get there. And then looking at what Maria just presented, as you start to collect data, really thinking about the frequency of the data, and if you can collect it over time, and really review it as a team over time, because sometimes you're going to see that you need to not just look at the quantitative data, but the qualitative data to really understand the story. So was there an astronomical point, and what does that represent? What's really taking place? So let's see if there are any questions in the chat, and I hope this has been very helpful to you. Okay, I don't see any last questions in the chat. I'm just going to give it one more minute. And then I'll have to borrow one of my former colleagues' sayings, which I just love, from Becca Thomas over in Massachusetts at the Department of Health there. She was the former Child Safety Coin Director, but she would say that no one complains about getting some extra minutes back in their day. So we thank you for your participation. We hope you enjoy having 15 minutes back in your day, and we hope that you'll apply some of what you learned today. Thank you so much for joining us. Please reach out at any point to any of the CSN team members or to Terry, who's offered his email address as well. Thank you. Please take a time to fill out the evaluation.
Thank you so much. Thank you, everyone, for joining us.